Earlier this week, we learned about how Buffalo police and social workers plan to work together to respond to some 911 calls in the future. A similar plan has already been put into effect in Cheektowaga at the police department there. And officers there say that adding social workers to the team has been one of the best things the force has done in years. Tonight, 7 Eyewitness News reporter Olivia Proya goes in depth to show us how all of this is working.
This is a different era. This is an era that has to happen.
Last year, Assistant Chief Brian Gould had an idea that would transform the Cheektowaga Police Department.
Law enforcement is expected to respond and handle all types of calls. If it's a drunk driver, that's our responsibility. If it's a person in mental health crisis, maybe we're not the best people to respond to that.
So we brought in Sarah Bonk, a behavioral health specialist, and together created the Behavioral Health Response Program. She worked side by side with officers, specifically her partner officer Jennifer Zimborski.
We both have different perspectives. I'm looking at the mental health perspective. She's looking at the law enforcement side of the house. So together we've been able to kind of really work on talking about our approach and how that's going to work to better serve the people.
They go to calls involving mental health crises together.
I will make sure that everything is safe, everybody's in a safe place, and then Sarah will naturally just come in.
Really what that involves is empathy, and that's probably the biggest engagement tool we have.
Yet the goal is to prevent a crisis from ever happening.
We look into the the nightly calls, and we see, hey, we've had an increase with this person. It seems like they're struggling. We need to go follow up. Our goal is to try to head off a crisis.
Officers even refer people to Sarah.
So one of the biggest changes I've noticed is the police department's willingness to ask for help on these calls or ask for follow-up.
This partnership has brought about significant change within the police department and the community.
I can say first-handedly, I've seen the change of the community. I feel the change of the community when I go and respond to calls.
An abundance of warmth from the community, more than I anticipated.
And they hope the positive effect of this program has had on Cheektowaga will now spread to Buffalo with the creation of the Behavioral Health Team, consisting of Buffalo police officers and clinicians, all led by Sarah.
We're sharing what we've learned on our program. We have built this program from the ground up.
In Cheektowaga, Olivia Proya, 7 Eyewitness News.